If you're getting ready this morning, pick out something blue to wear today. March 4th is Colon Cancer Awareness Day, and to kick it off, it is Dress in Blue Day. And Dr. James Groskreutz is with me right now from Gundersen Lutheran. Good morning, doctor, and you're actually going to talk to us more about how this disease, colon cancer, it's a disease that kills as many people as breast cancer and AIDS combined. Is that correct?
That's correct, Lindsay, and thank you for the opportunity to be here this morning to help spread the word. It's true, colon cancer is very common. It's the number 3 cancer in women behind lung and breast cancer, and it's the number 3 cancer in men behind lung and prostate cancer. But since it affects both men and women equally, it's the second most common cancer and affects 150,000 new patients each year. Unfortunately, that's a quite high number, but it is coming down with screening and prevention tactics that we've used for the last 10 to 15 years.
And when you talk about when you talk about screening and prevention, what are some of the guidelines of getting those screenings, and what age is the best time to start getting screened?
Well, the current screening guidelines call for a colonoscopy for every patient starting at age 50. Now, there are some alternatives to colonoscopy, but colonoscopy is the gold standard in that it not only screens for polyps or precancerous lesions, but allows you to remove those lesions at the same session. Other options would be what's called a virtual colonoscopy, which is a CT scan or CAT scan, or a shorter scope looking at part of the colon called a flexible sigmoidoscopy, or even a barium enema X-ray test. Those other exams are options, but they're not quite as sensitive, and again, they don't allow us the ability to remove a polyp at the same session as well.
And I understand a lot of the times that there isn't really any symptoms that are very apparent. And so how important is getting those screenings, and really what can you do to reduce your risk of colon cancer?
Well, it's very common not to have any symptoms, and the current guidelines, like I mentioned, are screening at age 50. However, if you have a family history, such as a first-degree relative, a brother, sister, or parent with colon cancer or precancerous colon polyps, then your risk is more than double, and the recommendation is starting at age 40. Colon screening, unlike many other cancers we screen for, can actually be prevented rather than just found early, because most colon cancers start as small polyps which grow over time and they eventually become a cancer. So by screening asymptomatic people, we remove these polyps before they get a chance to grow up and turn into something bad.
Well, thank you, doctor, for your time. We appreciate it. And just for everyone at home, remember to wear blue today to help raise awareness for colon cancer.